Hi everyone, welcome to the Math Therapy Sessions podcast. In today's fifth episode, we have Dr. Siddhant Pradhan. Dr. Siddhant is an oral surgeon, a cricketer, and the host of No Balls Cricket podcast. This is the video podcast. The links to the audio podcast are given in the description down below, so do check that out too. Siddhant, why oral surgery?
So, I mean, you know this better than most people, but I didn't really enjoy general dentistry at all.
Yeah.
But it was just, there's something about surgical work and working with my hands. And I was never, most people don't really like blood. I didn't really mind it. And there was this intense satisfaction from when you get a tooth out. And now having done oral surgery.
Was there any specific moment that, okay, this is it, I'm going to get into oral surgery?
There wasn't a specific moment, but it kind of built up to a point where you're like, okay, I don't really see myself doing anything other than that. You know, and that's when I sort of decided that let me just go with this. And then when I got into it, it was great.
You loved it.
I absolutely loved it.
So, because in dentistry, during the BDS days, you never had, you never showed any affection towards, major affection.
No, and that's the thing. I'm still not a fan of general dentistry. It doesn't excite me in the way that if someone asks me to do a root canal, I don't get excited. Someone asks me to pull out a cyst or something, my eyes light up.
Yeah.
That's the difference.
So you did basically MDS in oral surgery.
Yeah.
And how was the experience of doing MDS in India?
The experience is fabulous. And the thing, actually at DY, we were under a lot of really good surgeons. So, and you got to see a lot. So you get a lot of, trauma cases and things like that. So you did a lot of maxillofacial work as well. And it was just the exposure. There was so much of it. You got such a variety of things to see. Like I'd seen pretty much everything from, basic impactions to, neck dissection, cancer surgery, that kind of stuff. And then you saw joint replacement for TMJ, ankylosing release, and then a joint replacement. So you get the exposure was tremendous.
So how do you prepare yourself? For example, for example, root canal is a minor thing. Then to go from that to something like a major facial surgery, I mean, does it freak you out the first time you see so many? I mean, how do you cope up with that?
So the thing is, if you're with oral surgery, one of the main things is you have to be interested in it. I mean, I've never seen anybody who. There's a lot of people that do sort of, general dentistry and don't really love doing root canals or things like that. But they still kind of do it. With oral surgery, you have to enjoy it. Otherwise, there's no, it doesn't work. You don't get that sort of excitement. So for me, when I would look at a case like that, I'd think, oh, look, this is awesome. I've got this still removed.
Yeah.
And there's, I have to do this and that. And so the way then in the planning stages of it, I'd get really excited.
And how was your experience in doing masters in India?
No, it was a good experience. Especially with the MaxFax work, you get you're in the hospital setting quite a lot. And I thought for dentists, that's a bit different. Because you're never really in that environment until you start working there.
Yeah.
For us, it's a bit different because you get to interact with all of the other medical specialties as well. So, you make friends with the anesthetist, the general surgeon, ENT
It's the closest you can hop over to MBBS, I think.
I think for a dentist, it's possibly the easiest route into, not easiest, I wouldn't say easiest, but I would say it's the most sort of common, the closest to what a sort of master's student would be from, an MBBS route. You go through that and then you do your master's in general medicine, general surgery, and they're all in the hospital. So I think you kind of interact. It's a bit different, yes, but it's not, it's nothing out of the ordinary. Yeah, it's nothing out of the ordinary.
So basically, you loved the whole time in, when you did. So was it different from undergrad? How different was it from undergrad?
The first thing, obviously, I really enjoyed what I was doing there. So, it's very different from your undergrad because it's more focused.
Okay.
I think with the undergrad, and a lot of people I've spoken to always say this, that their undergrad degree has a lot of things that they really don't enjoy doing, but you have to learn it. And for me, that was one of the things where this was everything that I wanted to do. So it was a lot easier to get motivated to do it. And because of that, it's a very different experience to your undergrad.
But you do learn only a set of skills, right? Like towards one subject, or did that hamper your other aspects of dentistry, or not really?
Not really. I mean, you're never going to forget to do general dentistry, and it's based on the same principles. So if you have the option of, say you get someone who's come and he wants the tooth extracted, you have the option of saving the tooth. You'd still do that. You're not just pulling teeth out or pulling something out for the fun of it. You're actually trying to help the patient. And so you kind of have to stick to the same, you stick exactly to what you learned in your undergrad. You don't sort of deviate from that whatsoever because you're not trying to do any harm to the patient. But that's the thing. You never forget that. And I think that was the important thing that you learned. So you never forget the skills that you learned in your undergrad. But you learned and added new things.
Added new skills.
Yeah.
So like now you're doing MSc in oral maxillofacial surgery from Manchester.
Yeah.
And how's that experience?
It's a bit different.
In terms of?
So it's a lot more focused on actual oral surgical work.
Okay.
It's less on the MaxFax side of things.
Okay.
That's one. Two, the approach is very different to the way...
I was going to ask you that. Like, how different is it from India? Like,
so that approach to teaching is a bit different.
Okay.
In India, you'd sort of be left alone and unless you had a bit of a problem or you couldn't solve something, you need some help. That's when you'd get other people to come in and help you. And that's where you sort of, you make your mistakes and you learn from them.
Yeah.
That's what I always say. Here, they're watching every sort of step that you're doing.
Okay.
And if you go wrong, they will correct you at that point.
Okay.
They won't wait for you to find out, basically. It's a more hands-on, hands-on experience from them. I like the Indian approach as well because I thought, you get to make your own mistakes. But here it's before you've made the mistake, they've already corrected something that they think is going wrong.
Okay.
You see what I mean?
Yeah.
So I think that's an interesting way of teaching.
So like, do you start getting patients the very first year?
Immediately.
Immediately.
Absolutely immediately.
Do you have to give a certain test or no? It's just like...
No. I mean, once you get into the program, they know it's just going to be mostly clinical work anyway. So you get into the program and then they just start you off straight. And
so it's different in terms of teaching, or the approach, the whole approach towards dentistry is only different?
The approach towards dentistry is different.
Okay.
I think outside of India, they're a bit more conservative in what they do. In terms of treatment, it I wouldn't say it makes a huge difference, but I think they're a bit, they want to be a bit more sort of patient friendly.
They are pro-patient.
They're very pro-patient friendly. Whereas here you're a bit like, okay, this is the issue. Kind of have to do it. There's no other way around it. And I find that there's a flip side of things where here it's far easier. You get stuck in a situation. It's far easier to sort of
get out of it,
get around it and get out of that situation. Whereas there you have to sort of follow them, and they're very strict on their protocols. So you can get stuck in that sort of, limbo a little bit. But they're two different approaches and they both have their pros and cons. So it's just a different way of working.
But apart from oral surgery, you must have interacted with a lot of other specialities in Manchester.
Yeah,
so
of course you do.
I mean, how is it different? It's all the same,
I mean, most dentistry is more or less similar. I mean, if you're doing the basics of prosthodontics and occult change, the basics of endodontics and occult change.
It's just the approach that...
It's just the approach, exactly.
And which one do you prefer?
What do I prefer? I'm a bit on the fence, honestly. I don't know which one I prefer. There are days when I prefer one and then the other. So I'm not really sure. But I guess I'd only really find that out when I have my own freedom to do it. And I mean, I've got used to their style now. So that's one advantage.
So you have done your master's in oral surgery. So why MSc? Why MSc? You've done a master's and you're doing another master's. Why is that? Because that's one question which a lot of people ask you.
There's two reasons to that. One, I always wanted to get a different approach and exposure. I think that's the main reason.
But you could have done a fellowship also, right?
Yeah, true. But I don't think you get the whole sort of general experience.
Okay.
With your fellowships, you're way more targeted. So if you get out of it and then you just do a fellowship in sort of major surgery. Here, it's the whole spread of oral surgery. And I think that's a completely... I mean, people talk about, you get out of your MDS, you'll do a fellowship in, say, oncosurgery or TMJ or something. There's nothing that gives you a different approach to oral surgery. And that essentially is your bread and butter as an oral, as even an oral and maxillofacial surgeon.
Okay.
So it's in the title of what we do when we do our MDS here. But people take it, I wouldn't say they take it for granted a bit, but because everybody knows how to do it, there's no different exposure, different approach to that section of it. That's where I was interested.
So that's one. The
Yeah.
second one?
The second one, obviously, is it's a bit of an easy pathway into the UK. I think
Okay.
that's one of the other reasons.
So you're looking at practicing in UK
Yeah.
for the long term?
Yeah, definitely looking at practicing in the UK.
Because I'm sure a lot of them, must have thought you might come back after your MSc. I mean, probably later, not now.
I mean, I like you know this. I always have the option of coming back.
Yeah.
But I think just want a different
Much
lifestyle.
better.
Yeah,
Overall, it's the whole experience.
it's the whole experience for me. It's not only
And you're
about.
living in Manchester. I mean,
I know exactly.
So, you're a big Manchester United fan. You're doing masters in Manchester. I mean, you're living the dream. I mean, sort of a lot of people. So, I mean, how does it feel?
Well, I've actually.
when you learn that, okay, I'm going to do MSc in Manchester,
Oh, I was very excited.
Yeah.
Because it's you're right there.
Yeah.
It's not far away, the stadium.
Yeah.
At any point. And I actually got there during the worst possible time. I went at the height of lockdown.
Shit.
And the first 6-8 months, there was no football on. You couldn't go to the ground. I still haven't been.
You've never not seen any matches yet?
No, I haven't been. Well, not to a football game, no.
You're planning to soon anytime?
Oh, definitely. Yeah. I was actually planning on going and watching a game before, but I ended up getting COVID that week, so it kind of ruined a bit of my plans. But no, it's great because it's one of the few places where the actual. And I live in an area where it's sort of dominated by Man United fans. So
Thankfully.
Yeah, thankfully. And again, if you go to a different part of the city, it'll be City fans. But it's so funny how what happens on the football field basically decides the entire mood of that week. So you literally walk down the street and there'd be about 800 people swearing and yelling and and it's been very depressing for the last few months, obviously.
Yeah, true. Even last night.
Yeah. Oh, thank God I didn't watch last night.
I was watching it. I was like, it's okay.
Yeah, so that's the way it works there. It's quite an intriguing one.
So the thing is, I went to Manchester in 2018. So I was visiting my brother in London, and so we went to Manchester. We took a train. I was wearing a United jersey. So, I mean, I did not know what to expect because what if a City fan? I had no idea. So I wore a jersey and I wore a hoodie over it because I was not sure if anyone looks at the jersey, I mean, what reception I'll get. So the entire taxi drive from the railway station to the United Stadium, Old Trafford, I was hiding the jersey. And once we landed there, I mean, I took out the hoodie and I felt at home. I mean,
you feel comfortable there. Yeah.
It's funny. I mean, you are supporting a team which is miles away, but then when you land there at the doorstep, you feel like home. I mean, and you are living in the same city, in the same vicinity.
It's amazing you say this because I felt so comfortable in that city from the minute I've landed. It's just been, it's been really easy to sort of adapt there for me. And you walk around, and especially in Manchester, you see people wearing all sorts. I saw one guy walking down the street one day with a Liverpool shirt on, and I thought, how is he not getting beaten up?
True.
Yeah, so I mean, no, it's very friendly, and they're not. I think
most of the times they are friendly,
they're always friendly. I still haven't. I mean, of course, there's other people that have had different experiences, but so far in my experience, I haven't come across anything.
The food has been good. The people are nice. I mean, what more would you ask for?
No, absolutely, and actually, especially when the Euros were on, it was even more fun because you'd get these massive throngs of people. Singing "It's Coming Home" and things. You just walk down the street, and that's
it
the
almost came home.
I think I may have been the only one not supporting England that time.
At that time, I was supporting them when David Beckham was playing. So when he retired, I stopped supporting them because they had that golden generation with Lampard, Beckham, Gerrard. But it's okay. So and do you plan to go for example, I was speaking to a lot of physiotherapists who are practicing in Manchester, and they do get a chance to work at Old Trafford. Is that the case?
You do, yeah.
Is a hospital tied up with them in any way?
It is. So there's 3 or 4 big hospitals within the city of Manchester, and I think if you're a physiotherapist from the university, you do
Okay.
get a tie-up at both of the football.
Not for dentists yet.
No, not for dentists yet. But you do get a tie-up with both of the football clubs. So that's one advantage of doing physiotherapy in Manchester. Is you get easy access to that, and then the cricket ground's not far away either. So
Yeah.
you can get tied up with the
Have you
county
been to
team.
any matches yet?
Sorry.
Have you been to any matches as like any cricket matches?
Yeah, I was actually I was really upset actually when they cancelled the Manchester Test match because I had tickets for that.
Oh yeah.
Yeah, and
Yeah.
I was up at Leeds for the game that we
The
lost.
last one, right?
No, this is the one that we lost. I think it was the third one.
Mm-hmm.
The third
one, yeah.
And it was just such a fun experience because
The one where you were dressed for.
yeah, we went dressed up as Super Mario. And it's just such
I'm gonna put that photo at the intro.
no, it's a completely unique experience. In terms of there's just it's like a sense of enjoyment that's
Yeah.
there that's not there
in
in
India.
India. Yeah.
Because I showed that picture to a few friends and they were like, "Is he mad?" I was like, "No, that's their culture. Like they do that."
Oh,
They're
yeah,
very
that's their
open.
culture.
Yeah,
Yeah.
they're very open. Like because with you, there were many other people who were dressed up in various costumes.
So the first day I went there,
Huh.
we were dressed up obviously in the Mario costume, and in one of the other stands they had people that were dressed up as. So there was a bunch of nuns being chased around by the Pope. No offense to any Catholics listening to this. And the second day there was
At the stadium.
oh yeah in the stadium.
Wow.
They actually had them on the big screen. And then the second day, when we were in the party stand, they had a bunch of butchers chasing around a chicken.
Dude, that's crazy.
So I mean, and we ended up getting pictures with them after that.
Yeah, I saw.
Yeah.
And you played cricket with them, right?
Yeah. So when the game got over by about lunch, and then
At the fan zone? No.
no, so this was in the fan zone. So basically, you walk out of the stand, and you know, like where all the concession stands are normally.
Yeah.
These guys have just piled all their beer cans into a set of stumps. One bat suddenly appears out of nowhere. One of the birds is bowling at me. And then, that's it. You start playing cricket outside.
Yeah.
It was amazing. It was just such an interesting experience to have that happen.
You know what that reminded me of? We had this match during final year when we had the black jerseys and the rain washed away during DPL.
Oh, yeah, I remember this. Yeah.
And we were playing cricket at the, backstage.
Behind. Yeah. No, I remember this. I was there.
And it reminded me of that. So, speaking of all that, how did your love for cricket come up? Because you and Ian and Arjun are the three people who I know are into cricket since first year, since I know you. So talk through it.
I mean, I started watching cricket at a very, very young age. I must have been about 4 or 5. I started playing cricket properly proper leather ball, serious cricket, when I was about, I think, 7. So I've always loved it since then. I've represented both my school teams.
Yeah.
We played so much cricket at DY.
True.
And
Even more.
we played even more. And the thing was, after that, when I ended up doing my MDS, I ended up playing for the Sunday League team, which was, that's another entirely different experience.
Yeah.
There's a doctors league that, we all play in. And now that I'm in Manchester, I'm actually going to be part of that team as well. So it's just, straight progression.
Amazing.
Yeah.
And so along with cricket, you're also into squash.
Yeah.
So, I remember because you used to go to the club, right?
Yeah, I still do.
I still do. So, are you still continuing that in UK?
Yeah, I'm actually part of the squash team at the university now.
Wow.
But it's a great sport. I mean, it's very different to cricket, obviously, because cricket's a bit more laid back. This is sort of all action, all intensity, and it's an individual sport as well. And I love the sort of freneticness of squash.
Yeah.
We're always constantly running around.
Yeah.
And again, I played it at like a reasonable level when I was in school.
So basically, sports has a special place and a lot of importance in your life.
Oh yeah, absolutely.
So, what would your suggestion be? Because a lot of people, once they get into professional college, they leave sports. And that's something you are a prime example, wherein you're doing your master's degree and everything like that, but at the same time you're playing sports at a very good level. So
no, I think for me it's very important to keep playing sports, because I'm one of those people that if I just leave everything and just do one thing, I'll get like cabin fever and go a bit crazy. So I have to sort of do something to calm myself.
Yeah.
And I think sports really helps in that. But also I love it. I think you have to do things that you enjoy. And sports is one of, I mean, if there's a game on TV, it doesn't matter what sport it is, I'll sit down and watch it.
Any sport.
Any sport, could be any sport. Honestly, I love F1, football, obviously, squash. I could even watch tennis. So anything, you know.
And thankfully, luckily, wherever you have been, sports has been a part of it. Like DY is big on sports, Manchester is big on sports. So you have been lucky like that.
No, I have been lucky, definitely. I've lucked out on the 2 universities because you know
True.
you get to play a lot of cricket at DY.
Yeah.
And with Manchester, I'm doing both.
What about Manchester? Like, do you still get to play cricket?
Yeah. So the only difference I would say between the universities here and in Manchester with regards to sport is it's taken a bit more seriously there.
Okay.
So if you're doing it, here it was just a bit, you know, you'd have a few fun and games
Once a year.
or something like that. There you're doing it competitively. So you can still do your...
Even when you're doing a master's?
Yeah, you still have... I mean, I somehow have found enough time for it.
Yeah.
But I have training once a week for squash, training once a week for cricket. And there's games, you know, for squash on the Wednesdays, and I think cricket will start in the summer. But it's a unique sort of set of experiences that way, where they take it, and it's competitive sport. You know, it's not mild, it's not light or anything like that.
It is amateur, but it is competitive.
Yeah, absolutely.
And any other sport you're playing apart from squash and cricket in UK?
No,
Are you into video games? No.
I mean, well, not really. I've never been a big gamer. Okay. I've always spent far more time. If I had the choice, I wouldn't sit at home. I'd be outside.
Yeah.
So I picked up, like in the UK, I've picked up bouldering, rock climbing, that kind of thing. So that's really fun. And then every now and then go-karting, you know.
So if anyone wants to study in UK or say Manchester to be specific, how good do you think is the city for students like who want to come over and say like do dentistry? I mean,
it's actually got a really good dental school. I think that's one of the sort of things that attracted me to it. But the main thing with the university is it's attached to a very, very big hospital.
Okay.
And so you'll get a lot of patients. It's one of the biggest setups in the northwest of England. Because of that, you do get a lot of exposure. The teaching's great. And yeah, it's actually a great place to study. It's very student friendly. And it's a city university, so it's in the middle of the city.
And it's very close to a lot of other cities too, right?
Yeah, you travel maybe an hour. You know, I've taken the train out. The Liverpool's an hour.
Yeah.
The other side, Leeds, is an hour and a half. Only London's far away, but everything else is fairly close.
I think in the train, like it still took us 2.5 hours, but if you go by bus, it takes a good 6-7 hours.
It takes 4.5, 5 hours, I think. Something like that.
So anyone who wants to come, it's a good city, like, and it's something which you would recommend people to do that.
Oh, definitely. It's a different experience to a massive city like Bombay or London, but it's a bit smaller. But it's got this sort of mad energy about it that doesn't exist anywhere else.
And it's got good architecture, like
it's beautiful because it's got all of these old. It used to be the sort of center for the Industrial Revolution, so it's got these wonderful old sort of buildings that are around, and then you'll have in the midst of all these old buildings, you'll have this massive new skyscraper that looks insane, and then they have like converted warehouses and things, and it's just beautiful. Honestly, you walk through it. And
have you seen any footballers or any cricketers in Manchester? Like just like
so,
have you met any of them?
I haven't met them, but I crossed paths with Cristiano Ronaldo one day.
Wow! Like recently?
No, not recently. This would have been about 5 or 6 months ago. But I think he was about 5. I remember seeing it on Instagram. But there was this one Caribbean restaurant that I went to pick up jerk chicken.
Yeah.
And literally 10 minutes after I'd left, he was there. Like he went to the same place. So if anyone is listening, I eat the same chicken as Cristiano Ronaldo does.
I'm sure he has the same physique too as Cristiano Ronaldo. Dude, but also like speaking about that, your parents are like a powerhouse couple in dentistry. I mean, they both are accomplished dentists, and so having such parents, is it like a burden on you or like a responsibility, or does it motivate you?
It's a very big motivating factor, yes, because you see where they are and you want to automatically, your first thing is you want to reach that level. But it can be a burden at times. I think people can get bogged down by the weight of expectation.
Because more often than not, I see people getting bogged down, like, saying, I don't want to do what my parents do. They have so many responsibilities and I don't want to follow them. Like, I want to create my own path. Nothing wrong in that. But I think it's something which, will, like, motivate, because you see two people who are very successful, who are balancing life and work at the same time. And if they can, why can't I?
No, absolutely. But you want to still create your own path.
Yeah.
The thing is that there's no way I could become my father. Like, I can't be the same person. I'm a different person. I'll not follow the exact same pathway as him. I have to find my own way.
Yeah.
And my success depends on myself, not what he has done.
Yeah.
He can only teach me.
Yeah.
So I think if you stick to those sort of basic rules, you're absolutely fine. You don't get burdened by the weight of expectation.
Have they ever told you, like, you have to, like,
Oh, no, absolutely not. I've always been, even doing dentistry was my choice entirely. It had nothing to do with that.
Because, like, people do think, like, your father is a dentist, so he'll also become a dentist, and it's easy for them. But, like, people from the outside, they think, it's easy for him because he's going to get all this stuff. But for me, I think it's much more of a burden, because, like, you have to maintain that level which a father has maintained, and not just maintain, go over that. So that's an even bigger task. And, like, for someone like you who's doing it, you have not left it. I think you're on your way of doing something for yourself, because I don't know many people who are doing, like, double masters, like, and from.
I think mine's a bit of an interesting case because, again, I found my own sort of pathway through it.
Yeah.
And if I'm trying to give advice to people, I would say don't repeat what I've done. Right?
Why would you say that?
Basically, it's a similar degree to the MDS anyway.
Okay.
It's just helpful for where I'm going. But again, it's a different exposure. So I think if you get the best of both worlds out of it, that's great.
Yeah.
And then you can pick and choose. But I think if you really want to just go and settle down in the UK, there is no point in doing an MDS here.
Okay.
So I think that's the advice that I would give people.
So you were always keen on oral surgery, or you had few backups on your mind, like, if I don't get that, I'll
no,
get.
none whatsoever. It was oral surgery or bust for me.
Okay. And what if you did not get into Manchester? What was the second option?
So I had applied to do the implant certificate program at NYU.
Okay.
And I'd gotten in there. So that was the backup program.
It's a 2-year program, right?
It's a 2-year program. And of course, you work at NYU. It's quite intense, that one. But it's sort of, that's very focused on implant dentistry.
Also, you were at the Mayo Clinic, and you did a clinical residency program there.
Yeah.
For how long was that?
So I was there for about 3 weeks,
Okay.
3.5 weeks.
Because it's one of the most famous dental hospitals or chains or clinics in the world. And to work, just to be in that for a day is a big thing. You were there for 3 weeks. A lot of people would love to know what happened. How was the experience?
So, I think one of the things that they teach you there, first of all, the thing with the Mayo Clinic is the way they've set the place up. It is absolutely amazing.
Is it the building, the tall building?
Yeah, it's a tall building. Yeah, it is that one. I think the pure scales of operation were completely amazing. The technology they used was great. I would say they were wedded to a philosophy that really works.
Okay.
Sticking to all on 4, all on 6 implants, things like that. But what you get to learn there was how to deal with, cases where you can't do bone grafting.
Okay.
Difficult implant cases where you have to put in, say, a zygomatic implant or a pterygoid implant or something like that. They stuck to zygomas and all on 4, all on 6.
Okay.
But their whole thing was full arch treatments. That was the main thing that everyone goes there to learn. And the way they do it, they have a set protocol. If you learn that, you can have any of, say, 12 dentists doing that exact procedure. And it'll be exactly the same no matter how well trained they are.
They train you like that.
They train you like that. And I think that was the thing to learn from there.
But the whole experience of, like, so were there more people with you in that?
There was a few people that came in, they kept coming and going.
All over the world?
Yeah, from all over the world. So you got to meet, while I was there, I met 3 or 4 dentists from Canada. There was a guy from Germany that came. There was a Norwegian guy. And, you keep meeting people that keep sort of...
So, like, so I did a 1 year program in Manipal for implants. So one of the days, the doctors from Malo Clinic had come.
Oh, Dr.
to teach-
Armando.
Yeah.
Yeah.
They had come
Oh.
to teach us all on 4.
Yeah, all on 4.
So
Yeah.
he showed us everything, like, So
Yeah.
a lot of people were inquisitive. Like I may be one of the most younger guys who was a part of the program, but the senior guys out there, they were speaking to him and wanted to do the 3-week program and everything like that,
Yeah.
So like the way they teach you, I mean, they put so much confidence in you that once, like, you hear them and you're like, oh, I can do that. Like,
Yeah, I think they take the sort of mystery away from it. And people think it's very difficult to do. But they'll just show you a sort of easy pathway. And
Yeah, the
simple.
all
Yeah.
in 4 thing he showed me on the
Yeah.
model was like, that's it. He's like, yeah.
That's it.
I was like, okay.
That was the first thing I learned there. I was like, oh, okay, you have to know where your sort of anatomical landmarks
Yeah.
are, whether upper or lower. Depending on what the landmark is, just you learn how to avoid it. That's it.
But it's not for everyone, right? You can't just recommend going to the Malo Clinic because forget the financial part. Just like, you have to love doing that, right? Or, like, you won't recommend that to anyone.
I would recommend it to anybody who's interested in implant dentistry.
Okay.
I think that's, you have to go and see that. I mean, it's a well-established protocol. It's a well-established set of treatments.
So they teach you the protocol also?
Yeah, you get to see the protocol in action. They will give you exactly how they do it.
Okay.
And it's so specific that for example, they'll tell you what kind of, how much bone you need to remove to fit their Malo bridge on top. All of, everything. You get to learn it in detail and for different cases.
Okay.
So I think that's the great advantage because you get to see it in action as opposed to just their paperwork basically.
Also, this is one of my favorite questions is what's your favorite oral healthcare brand or any specific oral healthcare instrument you use at home and which you would recommend to people? Or,
I mean, I think the one, I'm not a big, fan of a lot of these things, but I think the one that I'm really happy with is the Waterpick. I think that's just
the Waterpick.
Yeah. It is a fabulous device. It keeps everything so nice and clean. Really helps it, sort of protects your oral hygiene beautifully.
They are the ones who started the whole water flossing thing.
Absolutely, yeah. And it's still, I would still recommend that if I had to be asked.
Any specific reasons why you love Waterpick? Like, I mean, do you have any specific reasons why you love the product?
No, I mean, I just know it was the first. And it's the only one I've ever used.
Okay.
And I haven't...
You've never tried any...
No, because it works so well. I didn't see the need to sort of veer from that.
It's a very simple mechanism,
such a simple
but it
device,
works
yeah.
flawlessly. How they implement that, it's very flawless.
Yeah, absolutely. It's a very easy device.
Also, any specific apps you use on your phone for dentistry on a normal day-to-day basis?
So, I don't think they have it here, but
Which one is that?
it's in the UK. So they have this sort of database called the BNF.
I don't think they have.
No, I don't think they have it here, but it's a database called the BNF, which basically allows you to find. It's fabulous for like pharmacology and the drugs that you're using.
Okay.
And I think it's one of my
a pharma
favorite
app,
things. It's basically a sort of dental pharmacology app.
Okay.
But it's linked to this database, and what it basically allows you to do.
How do you spell it?
It's just BNF. The letter.
BNF?
Yeah,
Okay.
BNF.
So it's a website or an app?
It's both. So you have an app as well as the website.
You have to pay for it?
I don't think you can get it in India, but I know in the UK it's free.
Okay.
It's free, and all of the hospitals have a sort of, journal. If you don't want to do that, you just you go to the app, type in the name of the drug, everything pops up in a second. You know what interactions, and I think that was one of the things I found out from that is that you'll have a simple drug that you think doesn't interact with something else, and then it might pop up.
Oh. I mean, you do have some similar apps, but I don't think it's that. It has that ease of use. What you're seeing, like everything just pops up. Like, I know apps, but they're very. I wouldn't say cumbersome, but then you have to click on many things to reach that particular drug.
Yeah. So here it's just you literally pick your drug, and all of the information will just pop up.
I'm sure there are people out there who can use various things to get hold of that website.
No, I'm sure, but it's just the one that I thought was just most. It was just the easiest.
Yeah. Also, what's your favorite dental instrument? Like
So-
something which probably you may not be using now, but you get it only in India or anything like that. But it's your favorite. You absolutely love it.
I think the one that I've found that I can't live without now is a Luxator.
Okay.
It's just made dental extractions so easy. It's made it so much simpler. I mean, obviously, you still have to use your forceps and everything, but it makes life so simple, especially when you have a difficult extraction. It's below the crest of the bone, and you just go glide along it, comes out. It's made life very, very simple for a lot of oral surgeons, and people will,
Any specific brands, like, is there any specific brand that
in
you would recommend?
So the Indian ones, actually, GDC has some great luxators.
Okay.
They do some very nice thin ones, fine luxators that can get between, split the PDL fibers and get through. It's beautiful.
And any specific color? Because I'm seeing a lot of colorful luxators now in the market. So you don't have anything specific in your head?
I mean, you can get a colorful luxator. The tip is the important bit.
No, but do you love, do you have any specific color? Because I know many dentists who are like, I just want a pink color, I just want a black color.
Yeah, if I had the choice, I'd get a pink one.
A pink one. A baby pink one.
Yeah, baby pink.
It reminds me of the pink jersey we always wanted to have.
Yeah, I know. I still haven't got it and I still want it.
I mean, would have looked ridiculous, but then I'm
No,
sure we would have pulled it off.
We'd have pulled it off.
The closest we've worn yellow, red, green, blue, black.
And the black had like a nice gold trim on it as well.
I'm sure even the baby pink would have looked good on us. We would have carried it off.
And actually, while I'm at Manchester, I'm also wearing purple.
You did?
Yeah, they have.
So the theme is purple.
Yeah, the color for
I'm
the.
sure that you need to go to NYU because their theme also is purple. So I was there for a bit, for a few months in NYU. So
Right.
they have a theme which goes from. It's purple.
It's purple.
It's
basically.
purple, basically.
Yeah.
What's for example, you have a lot of young dentists coming up and who are doing dentistry, who want to join dentistry, who have passed BDS but now want to do masters. So if you had a chance, what would you suggest them? Do dentistry? Should not do dentistry? If they're doing dentistry, should do this? What would your opinion about dentistry in general in today for a student be?
I mean, do what you love. I think that's one of the things that I've followed. I've basically done exactly the kind of dentistry that I want to practice. I'm getting into.
Okay.
That's what you should do. If you are one of those people that is a very patient, diligent kind of person, likes endo, do it. You want to fiddle around with small gum surgeries and things like that, do perio.
Yeah.
Do what you love. Don't be in a situation, you're going to have to learn everything anyway. Don't be in a situation where you think you can be able to manage everything at a very high level. You won't.
Okay.
Pick one thing if you want to do an MDS, especially. Pick one thing that you think you'll be the absolute best at.
Okay.
Or that you love the most.
Okay.
And then go for that.
But in today's time, would you suggest people to pick up dentistry?
That's a difficult question.
I know it differs from
Yeah.
a lot of factors, a lot of situations. Agreed. But then, if you had a chance of doing dentistry all over again, would you? That's the easiest way I could ask you.
Because I ended up really enjoying it.
Yeah.
I would still do it.
Yeah.
Yeah. I think that's
That's what I was looking for.
Yeah, that's the main thing.
Yeah. And is it okay if they don't do MDS, or it has? They have to do it.
You have to find your own career path. I've seen people that haven't done an MDS and are still fabulous dentists.
Yeah.
They know, some of them do better endo than
Just coming
endodontists.
from you will make a difference because you have, you're doing masters again, and then to come from someone like you would be great for people who, it's re-emphasizes the fact that you don't need to do an MDS to be successful.
No,
But then if you do, it's great. If you don't do, it's fine.
Yeah. At the end of the day, the way you do your work is going to define who you are.
Okay.
And the number of degrees you have really does matter. So, I would still say do it.
Yeah.
Because it's helpful.
Yeah.
And if you're really interested in a particular subject, it will be great. So, you can manage without it. But it would be nicer if you had one. That would be my advice. Yeah.
Also, you have your own podcast. One of the earliest adopters in the whole podcasting thing, who I know, was you. You started your own podcast, so you have to say something about what a podcast is, what's the name, what is it about, and where do you want to take it?
So, I mean, my love for cricket also extended to the love of broadcasting. So we started. It was three friends that initially started. This is about 4 years ago now.
4 years.
Yeah, we've had it since 2018. I remember it was just before the India-England series in 2018 that we started the podcast.
So it's an audio exclusive podcast, or it's video also, right?
No, it's become video now. When we first started, it was purely audio.
Okay.
And we were just three guys sitting around a mic and recording. And we had some fairly controversial opinions. And basically, it was just, making fun of each other and making fun of cricket. And there was a few serious points thrown in. Before I moved to Manchester, we kind of went on hiatus because one of my friends decided that he didn't want to do it anymore. So it was just the two of us left.
Okay.
And through the lockdown, I think we got the idea from Zoom because I don't live in the same city as my friend who's with me on the podcast.
Yeah.
He lives in New York. I live in Manchester.
Yeah.
But we kind of managed it because of Zoom. And we started actually last year from the India-Australia series. Just after that.
Yeah.
And then we decided that we'd do video, obviously. But then, you can add so many fun things on it. So when I went to Headingley, you'd see all the costumes and things like that. And I thought I wanted to make it fun.
Yeah.
And the name just suggests that.
Yeah.
It's called No Balls Cricket.
It's there on Spotify?
It's on pretty much everything. Spotify, Google, Anchor.
Perfect.
Everything. And we're on YouTube as well. Yeah, it's great. It's really fun.
And where do you want to take it? You're fine with its current iteration, or do you want to expand it to a bigger thing?
I mean, I would really enjoy it if it became a bit of a bigger thing. For example, we did an interview with Rob Moody. If anybody knows who Rob Moody is. His collection of videos on YouTube is just legendary.
Yeah.
What I realized through that is I wanted to do sort of more with it. So we're currently in the process of tracking down a few very interesting cricket YouTubers. They're not ones that are making sort of informational videos or another podcast, but they do their own sort of different things. Well, there's an interest in cricket, but it's not related to just talking about the game.
Okay.
Okay. Yeah. So it's things like
so it's only going to be an online thing, or you plan to take it offline too, sometime in the future.
I mean,
because I see what opportunities you have, and you can take it offline. You can go in the stadium and have this fun conversation with supporters, fans, have a little bit of banter with people. You could do that.
No, I mean, I've thought about it, and we did. We sort of did do it at Headingley with the when we were playing the concourse cricket. I thought that was that was a bit fun, a bit of the fun thing. And also you get sort of influenced by some of the, if you've seen the Man United fan channels, Stephen Howson and people of
who
that
doesn't know Arsenal TV, fan TV.
Oh God, no. No. That name does not get taken in Manchester very often.
No, I'm just saying, I'm safe in India, but that's one of the most hilarious shows out there.
No, absolutely. Arsenal fan TV is great. There was that absolutely crazy guy, Mark Goldbridge, who everyone thinks is an absolute nightmare. And but there's also something. My aim for the podcast is where I wanted to end up being.
Okay.
Is something like if you watch the kickoff. So you sort of have, it's essentially like a round table of people discussing or watching cricket. I think that would be the ultimate end goal.
Yeah.
If I get to that point, I'll be happy, man.
Yeah. You're getting to sit with your friends, talking about the thing you love, and hopefully make money out of it.
No, absolutely. You make your.
It can't get better.
No, it cannot. It literally cannot get better. And you're talking about something that you really enjoy.
So, apart from podcasting and sports, how do you relax? How do you chill? How do you, in your small little free time? How do you spend your free time? Do you read some books, or I don't know?
So lately I've gotten into playing a lot of chess.
Okay. Online or
no, online.
Online.
There's a great website called chess.com.
Okay.
And you play people all around the world online, time games, and it's great because it takes your mind off of things, but it keeps your mind sort of occupied. You know, I think that for mental stimulation is fabulous. And if I have to watch Netflix, that's the only other thing.
And you had a great collection of music too, because whenever we used to sit in a car, because you used to put those like some songs I've never ever heard of, and they were great. I mean, I may not have admired them back then, but now to come to think of it, you know, like, so you had a good taste in music too, like, you know. So I mean, do you play anything or?
I mean, so this is years ago now, but we used to have a band,
Yeah.
a rock band, and I was actually the singer. I can play guitar a bit, but no, I've always been a fan of rock music, and reggae. Got into reggae very heavily because of Ian as well. I mean, not that I wasn't into it before, but he just made it better. But no, I really enjoy that kind of music. So if I'm sitting down and listening to something, it'll always be that. And I'm not one of those people that likes listening to something that everybody's listening to.
Yeah.
I'll have to find my own thing. I
I'm
think
sure
for me,
about
that's
that.
important.
Because whenever I sat in a car, I've heard music which I've never heard anywhere. Not MTV, not on the radio. Something different.
Yeah, most of my stuff will never be. I'm not a fan of like overly
The
commercial.
conven-
Yeah.
The
Conventional.
commercial part
Yeah.
of it.
No. So it has to be something different.
I was thinking that day, like, when you asked me about the podcast, I'm like, hopefully, I don't know, maybe in the future, if Ian is there, probably we all are there in one city, we should have a podcast because, I mean, of course, you have more, but then we have so many memories with Ian and, like, he has so many experiences to share with us, so many things I want to ask him on record, which, I mean, I've asked him off record, but then I wanted to be on record, so that people know, like, we had a guy like him in
It's hard to believe that there's a guy like him around. No?
yeah.
I mean,
I
you've
never-
seen the beard.
Yeah. I thought it was a joke. Like, and like a filter.
Yeah. No, well, I thought it was a filter too initially. And then he WhatsApp called me and it was actually green. And I'm just thinking to myself, why would someone do that to themselves? And he kept it for like a week.
Yeah. Oh, so it's out. It's not there anymore.
I have no idea. I haven't spoken to him in a week.
Oh, shit.
It was there last week. No, but he's fabulous on the podcast as well.
No, that's what, like, like hopefully in the future, you never know where life takes you, but hopefully we'll meet up again and when it'll happen. So, before I leave you, what's next for Siddhant Pradhan? Like, you're in your second year?
I'm in my second year.
So next is final year.
Next year is the final year.
Then what?
Well, try and get a pathway into the UK. I think that would be the first aim. But also just better myself in general.
Okay.
Try and become the best oral surgeon I can be. That's the idea. And, find opportunities there that
You want to study more?
I think I'm done now.
PhD, fellowships, yeah, like
The PhD is always an option there.
I knew it.
But I think right now I'm not
After a
thinking of
break.
that. After a bit of a break. I do like actually operating. And I'm not saying I don't like research, but if I had the choice, I'd pick actual surgery over research.
So, one thing I had in my mind is when you come back to India, like in your holidays, do you practice here or like you just like relax?
Well, I mean, this is the first time I've been back, and it's been a very short holiday, so I haven't done any practicing. But I think maybe the next time, if it's a longer trip, yeah.
As Dr. Pradhan told you, like let's go. No.
Not on a short 2-week holiday, no. I think it was a bit longer, it would have been a different story.
So apart from dentistry, what's next? Like you say, anything more you want to add on to that? Anything, podcasting, anything?
I think the podcast is the next most obvious thing for me.
Like apart from being an oral, like a fabulous oral surgeon, is anything more on your anvil?
So that's one thing. Get the podcast.
Like, for example, do you want to start a company? Do you want to do this, do that, or something like that?
No, I mean, not particularly. I'm not. I've never been one to have like a proper business mind. So I think I have to stick to what I know, which is oral surgery, which is doing. And I love sports. I love doing the sports journalism bit. And I think if I had a sort of alternative career path, that would be it.
It can still be like it can be a small part.
Yeah, I mean, you can. That's what we're doing basically with the
Yeah.
podcast. So if it gets bigger, then it gets bigger. We get.
And what's one guest you want on your podcast? Like,
Oh, one guest that I want on my podcast.
like you would love pay anything, like not pay, but then you would love them to have.
You know, at this point in time, I would love to have Virat Kohli on. Honestly, I think he's
Give it a few months or a year or two.
or a year.
Once he's retired. I'm sure. Like,
I mean, it would always change with time.
I mean, being in Manchester is one of the best ways of catching hold of my thing, because whatever I've like seen on media, they're very much more open. Like outside India, they can go out, roam outside, and to catch hold of them is much easier. I'm sure in India you can do that, but then Virat Kohli, right?
Virat Kohli and maybe Ravi Shastri.
Ravi Shastri.
Ravi Shastri. Why? Because of the memes. Not because of anything else. Some of those memes from last year.
Good.
I don't know whether I'm allowed to swear or not on this one. I know
You can.
Oh, okay.
It's an
When
explicit.
he says Gote Jam.
Shit. But you'll have to get a lot of drinks for him.
Oh, yeah. I mean, I'd join him.
Yeah, exactly. It's like, so that's good. So good to have you here.
Thank you for
on
having
a
me.
very short podcast, but loved all your insights. Probably will help a lot of potential students out there who want to travel to Manchester or who want to join dentistry. At the same time, you did share a few bit of your experiences, and it was great having you. Hopefully, we'll again have you soon, probably on next holiday or when we meet in UK. So,
Definitely. And
thank you.
If you have any opinions on cricket, you're most welcome to join us on No Balls.
I do have a few opinions, but then I'm gonna wait it out because what we can do is I do know a few bit of backstories what happened during DPL. So if you have a DPL exclusive podcast, count me in. I'll do that.
I think that's one of the things that I want to do as well.
Yeah,
on
like,
it. Yeah, I think that's a good idea.
And for that, you can call in many people, like for some few minutes
Few
each.
tidbits.
Yeah, and a lot of people have a lot of funny stories. Like,
There's some very funny stories
Yeah.
from that tournament over the years.
so thank you, Siddhant.
Thank you so much
Nice
for having
having
me.
you. Okay, thank you. I'll see you soon. Thank you. Done. Thank you.
Ah, that's good, man.
Yeah.
Your setup is awesome. I thoroughly enjoyed it.
No, so the thing is,